Looking at drugs for urinary tract disorders. Urinary tract infections can be upper UTI like pyelonephritis, which are usually in female patients, and the symptoms include chills, fever, flank pain, painful urination, frequency, urgency, and pyuria. Lower UTI, which are more common, like acute cystitis or prostatitis, where the symptoms include pain and burning on urination, frequency, and urgency. Treatment of UTIs, oftentimes macrodantin or nitrofurantoin is used. Also Bactrim or trimethoprim sulfamethoxazole. It's a combo drug. So fluoroquinolones can also be used. Cipro can be used, but does carry that risk of tendinitis, especially in the Achilles tendon. With this tendinitis, people can succumb to tendon rupture, so that's not used as often anymore. So other agents that can be used are augmentin, some third-generation cephalosporins, and sometimes the UTI is so bad that IV therapy is required, followed by oral therapy. So one drug that can be used is macrodantin. It can be bacteriostatic or bactericidal. So bacteriostatic just slows the growth. Bactericidal actually kills it off. And it depends on the dosage. They're effective against many gram-positive and gram-negative, so that indicates that it is broad spectrum, especially effective against E. coli. Another drug that can be used is Hiprex. So if somebody's got chronic UTIs, this is probably what they would use. So it's bactericidal when urine is acidic. So you want to teach patients to consume acidic foods and fluids. Side effects and adverse reactions you teach also. These are definitely not to be taken with sulfonamides. Then we look at trimethoprim and trimethoprim sulfamethoxazole or Bactrim, Cepra. They're used in treatment and prevention of acute and chronic UTIs. The fluoroquinolones, like Cipro or Naroxen, Floxin, these treat the lower UTIs. They do have the side effects and adverse reactions, including Achilles tendon rupture or tendinitis. So urinary analgesic would be pyridium. This is a wonderful drug. It relieves the pain, the burning sensation, and the frequency. It can cause GI upset. It will cause the urine to be red and orange, and that will stain their clothing, but it's not harmful to them. There could be blood dyscrasias, there could be nephrotoxicity and hepatotoxicity. So some urinary stimulants include bethanechol or uricoline, which you've seen already, a direct-acting parasympathomimetic or cholinomimetic or cholinergic. They treat the hypotonic bladder. The neurogenic spinal cord injury patient might require this. So it increases the bladder tone of the detrusor muscle, and is contraindicated in peptic ulcer disease, and the side effects include GI distress, dizziness, and fainting. Urinary antispasmodics like ditropan. This is the one on the commercial where the guy is driving or the woman is driving, I can't remember, with the porta potty on the back of a trailer hitched to her car. It directly acts on the smooth muscles to relieve spasms. Side effects include drowsiness, tachycardia, dizziness, fainting, blurred vision, dry mouth, and constipation. So patient is taught that they shouldn't take if they have glaucoma or urinary obstruction or GI obstruction. So we do want to use these cautiously with a history of cardiac, renal, or prostate or even hepatic problems, and just alert the doc if they do have these issues. Detrol is another one that has some silly little commercials, but it's used for control of the overactive bladder, decreases the urge and increases urinary continence. They're the same side effects as antispasmodics, anticholinergics.